Hi, I'm Austin Mazarek, and I'm going to be doing a video presentation on neurofibromatosis. Neurofibromatosis is a group of genetic disorders that affect the brain, the spinal cord, and the nerves. It's where tumors develop anywhere in these spots, and they could vary in size. They're usually benign, so that would mean non-cancerous, but they could grow very big. I've had some personal experiences with neurofibromatosis. My brother actually has it, so that's kind of like the whole reason that I wanted to do this presentation was to make it more aware. The different types of neurofibromatosis are neurofibromatosis 1, which is usually in a child, or the child grows up with neurofibromatosis 1 or is diagnosed with it from a gene mutation, or it's inherited by the parent if the parent has it. Neurofibromatosis 2 is usually developed later in life, along with schwannomatosis. But schwannomatosis is actually rare, so it's a lot less common to see people with schwannomatosis rather than NF2 or neurofibromatosis 2. There's three different symptoms, or there's three with the three different types of neurofibromatosis. The symptoms are all different. For NF1, flat, light brown spots on the skin, freckling of the armpits, tiny bumps on the iris of the eye, soft pea-sized bumps on or under the skin also, bone deformities, tumors of the optic nerve, learning disabilities, larger than average size head, and short stature. For NF2, we have gradual hearing loss, ringing in the ears a lot, poor balance, and headaches. Another thing to note, with NF2, it could lead to schwannomatosis or schwannomas in other nerves, including the cranial, spinal, visual, and peripheral nerves. People who have NF2 may also develop benign tumors. Some indications that these could be benign include pain, numbness or weakness in the arms or legs, balance difficulties, facial drop, visual problems on the cataracts, seizures, and headaches. Schwannomatosis. Chronic pain, which can occur anywhere in the body and can be disabling. Numbness or weakness in various parts of the body, and loss of muscle. So the muscle will actually deform and it'll go. Keep in mind though, with schwannomatosis, it is relatively rare, like I was saying before, and usually affects people after the age of 20, and symptoms usually appear within the ages of 25 and 30. Plexiform neurofibromas association with NF, or neurofibromatosis. Plexiform neurofibromas are also known as plexiform tumors. These tumors are benign, and they could grow along nerves anywhere in the body. 30 to 50% of children with NF1 develop plexiform neurofibromas. These PNs, or plexiform neurofibromas, can negatively affect different parts of the body. PN tumors are also progressive, meaning they can grow until they're as big as they want, and they can grow as long as they're not treated. Heredity and neurofibromatosis. Neurofibromatosis can either be an inherited disorder or the product of a gene mutation. Both NF1 and NF2 are caused by two separate abnormal genes and may be inherited from parents who have NF, or may be the result of a gene mutation in the sperm or the egg. NF is considered an autosomal dominant disorder because the gene is located on one of the 22 chromosome pairs, called autosomes. The gene for NF1 is located on chromosome 17. However, the gene for NF2 is located on chromosome 22. Children have a 50% chance of inheriting the genes that cause NF if the parent has NF also. The type of NF the child inherits will depend on what type of NF that the parent has. So, if your parent has NF1 and you inherit it, it's either a 50% chance that you get NF1 or it's a 50% chance that you get neither or nothing. The same thing for NF2. It always stems from what kind of NF the parent has. So there would be a 50% chance that the child has NF2 if the parent has NF2. Main causes of neurofibromatosis. NF1 is caused by mutations in the gene that controls production of a protein called neurofibromin, which is also called neurofibromin 1. This gene is believed to function as a tumor suppressor, In about 50% of people with NF, the disorder results from a gene mutation that occurs for unknown reasons, which is a spontaneous mutation. NF2 results from mutations in a different tumor-suppressing gene, which is neurofibromin 2, also known as Merlin. Some people with NF2 experience a gene mutation that also occurs for unknown reasons, just like NF1, while others without the gene mutation inherit it from their parents. Schwannomatosis is not well understood. It's estimated that 85% of cases have no known cause, while 15% are inherited from the parent. How neurofibromatosis is diagnosed. Neurofibromatosis 1 is diagnosed from a combination of findings. For children to be diagnosed with NF1, they must show at least 2 of the aforementioned symptoms associated with NF1. A physical examination by a doctor familiar with the disorder is usually performed. Neurofibromatosis 2 is diagnosed by doctors paying close attention to hearing loss. Hearing tests as well as imaging tests are used to look for tumors in and around the auditory nerves, the spinal cord, and/or the brain. Genetic testing is also used for diagnosing NF1 and NF2. Testing conducted before birth is helpful to identify individuals who have a family history of the disorder, but do not yet have the symptoms. Still, gene tests have no way of predicting the severity of NF1 or NF2. Genetic testing is performed by either direct gene mutation analysis and/or linkage analysis. Mutation analysis looks to identify the particular gene changes that cause NF. However, linkage analysis is useful if the mutation analysis does not provide enough conclusive information. So basically, use one test. If the one test doesn't work, go back to the other one if you don't see a lot of information. How neurofibromatosis progresses. NF progresses differently in each person. It is hard to predict the course of the disease. A person's prognosis depends on the types and locations of the tumor that he or she can develop. NF1. Most people will have mild to moderate symptoms that worsen over time. Patients can live normal and productive lives, though, so that means exercise is also appropriate for people with NF. In some cases, however, NF1 can affect the quality of life. NF2. These tumors usually grow slower, and balance and hearing may become worse over time. Sometimes tumors grow next to vital structures such as the brain. If they are not treated, the situation can become serious. Schwannomatosis. Some patients have mild pain, but most have significant pain, and the pain can be managed with treatment. Treatment being medicine, over-the-counter medicine, or anything that gives you enjoyment away from pain. There's also different names for neurofibromatosis. For NF1, it's von Recklinghausen's disease, von Recklinghausen's phacomatosis, von Recklinghausen's neurofibromatosis, neurofibroma, and multiple. And for NF2, we have bilateral acoustic neurofibromatosis, vestibular schwannoma neurofibromatosis, and central neurofibromatosis. Then we have a treatment plan for neurofibromatosis. There is not a cure for neurofibromatosis, but signs and symptoms can be managed. Generally, the sooner someone is under the care of a trained doctor trained to treat the disease, the better the outcome. Monitoring is important for children diagnosed with NF1. Yearly age-appropriate checkups are recommended, and these checkups usually monitor the child's skin for new neurofibromas. They also measure high blood pressure development, growth and development, height and weight, and head circumference, early puberty, skeletal changes or abnormalities, learning development, and a complete eye examination. Medication is also a slight treatment for NF, with Cosi-Lugo being a treatment for plexiform neurofibroma in children. Surgery is basically the main form of treating neurofibromatosis. Surgery and other procedures are also signs of treatment, with removing tumors from parts of the body, and the tumors or the part of the body that the tumor is associated with. Stereotactic radiosurgery is a procedure that delivers radiation to the tumor, and it does not require an incision, so the tumor is suppressed, or the tumor is removed. And auditory brainstem implants and cochlear implants, which might also help improve hearing if you have NF2 or hearing loss. Pain management is also a temporary treatment for schwannomatosis, with drugs for nerve pain, antidepressants, serotonin and norepinephrine reuptake inhibitors, and epilepsy medications. My personal history with NF, like I said before, my brother was diagnosed with NF when I was growing up, so it was difficult with the doctor and everything, and going back and forth. But I wanted to just like put this in here because I wanted to make it known that I do have like experience with this and I do know what I'm talking about. So the reason why I wanted to do neurofibromatosis as something of interest to me is because growing up, my brother was diagnosed with NF1, like I previously just said, and it has been a long road for him. He's had numerous surgeries to remove countless tumors off of his body and under his skin. NF1 was also one of the main reasons for my brother's scoliosis and stunt of growth, which eventually led to him becoming partially paralyzed for several amount of months. Thankfully, his NF has not been acting up and benign tumors have ceased to grow. He is fully functional after having surgery to fix his scoliosis associated with NF1. It brings me so much joy to choose a topic to present on that relates to my personal life, and also it allows me to bring awareness to everybody else's eyes around the disease that people don't know about it. So the effect of neurofibromatosis on the exercise response. Exercise is a very efficient way to alter the difficulties of fine and gross motor skills for children with NF1. Children with NF1 experience difficulties with coordination. Exercise can be beneficial for the children diagnosed, and it is imperative that the young children with NF1 exercise to help fix coordination difficulties, not only for when they're young, but when they grow up also. How does exercise help neurofibromatosis? Many children with NF1 will experience developmental delays throughout the course of their lives. So the best way to basically keep children on track with neurofibromatosis is to get them outside and get them going. Team sports, individual sports, stuff like that. Participating in these team sports and activities also help to develop teamwork in the child's life, which is imperative for the child with NF1 to have since they do often experience learning disabilities, attention deficits, and coordination difficulties. Exercise can help improve function of the muscles and joints of the child, along with adding efficiency in fine and gross motor skills. So here's my case study. Mark is a 12-year-old boy who growing up has had coordination difficulties and has dealt with NF1 all of his life. His height is 4'4" and his weight is about 66 pounds, along with a normal blood pressure of 118/78 and a heart rate of 60. With Mark being diagnosed with NF1, there was no trace of any other family members with the gene mutation for NF1. Family history does include diabetes, heart problems, and forms of pancreatic cancer. Mark's goals are to be able to function properly like a normal 12-year-old boy would. He's really interested in playing sports, but still has a bit of coordination issues in his legs. For the exercise testing I wanted to perform, I wanted to do a muscular endurance test to see how strong his legs were, a cardiovascular endurance test because he does have those coordination difficulties, and we're not sure how much he wants to exercise, or he has exercised in the past, even though he is a kid. And then we also have the 6-minute walk test to test the durability of his legs. For my exercise prescription to give to Mark, Mark's exercise prescription will incorporate activities that benefit his liking for 60 minutes a day. These activities will include walking around the block with his dog Sparky and his mother for 15 minutes a day, set for 7 days a week at a low intensity. He will also perform throwing the baseball with his father for a low to moderate intensity for 30 minutes a day for 7 days a week. As for the other required 15 minutes, he will be performing stretches and flexibility exercises on his trampoline for 7 days a week. So in conclusion, neurofibromatosis has had a lasting impact on my personal life for as long as I can remember. With a disease like this being as rare as 1 in 3,000 people receive the disease, it needs to be brought up and heard by the voices that know something about it. If I learned one thing from this presentation, it's that there needs to be more research done about the disease. Following this presentation, I hope I got my point across as to how severe this disease can be for someone who is diagnosed with it, and the difficulties that these people deal with day in and day out. These are my references for my presentation, and I'm finished.